From the PIIC Center, we have the office manager, McKenzie and Trimble, and infectious disease specialist, Dr. Donna O'Neill. Good morning.
Good morning.
Good morning.
Good morning.
Welcome
Family
back.
show,
This
isn't
is a
it?
family show, yes.
Yes,
This is
it's a
family.
lot show.
Yes, we have mother, daughter, father, son.
That's right. Well, what should we talk about?
Families. Family
Okay,
issues.
go ahead, you start.
How long have you worked together as family?
12 years.
How's it going?
It's going very well.
Yeah.
But to be honest with you, when they were little and we had those snow days, those were terrible days for us because we had no child care, so
Right.
they would have to come into work with us and they'd be put to work at an early age.
So you must have enjoyed it because you're still working there.
Yeah, putting stickers on charts was great. And she didn't believe me, and then she found a picture of my brother, and sure enough, he's sitting there putting charts together.
So they started young.
Yeah.
But no patients were harmed.
No.
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 No, not at all. So, well, let's continue on that family topic. Talk a little bit about what it's like working with the top infectious disease specialist in the country.
It's good. I don't think of it that way.
Yeah.
I mean, I'm sure you don't either.
No, he's definitely not the top infectious disease
No, I'm
specialist
not.
in the country, for sure.
But yeah, I've just kind of gotten used to it.
Yeah.
We get along very good at work.
That's awesome.
I can read her mind, so.
That's very good.
Yeah.
Very good.
I think it's hard for her. I mean, you have different expectations. So I think it's, we balance it well. It can
Yeah.
be a little tricky at times. But she does, it's a small business, so we all do lots of things. And on top of, working full-time, she's a full-time student, nursing student. She'll be graduating in December.
Awesome.
Yeah,
Congratulations.
thank you.
So what health issue are we worried about this summer?
I thought we'd talk about a little bit about ticks, but I wanted McKenzie to address, she answers a lot of patients' questions, and I get to listen to her day in and
Okay.
day out. And I thought she might want to share with your viewers something a little bit about insurances. I have the easy job. I get to take care of patients. She has the hard job, and that's the billing and the prior authorizations, which is getting harder and harder each year.
So a lot of patients don't really understand their insurance until you get sick and you need to use it. And insurance likes to play with semantics. So even if you call your insurance company, you could get 3 different answers to the same question. And if you don't know kind of what to ask, you are going to get the wrong answer. So even just this week, I had a patient fighting with me who said, my insurance said I wasn't going to have a copay. I wasn't going to have a copay. But then he got his bill and he had his deductible and coinsurance. And he said, well, I was told everything was going to be covered. And while that might be the case, I mean, he didn't have a copay, but he had that deductible. So if you just don't know what to ask, you're not going to get the right information. And as a biller in the office, it's hard because you're trying to explain to patients, in language that they don't really know.
Right.
And they're obviously frustrated and mad because they often say, well, what am I paying for then? Why am I paying all this per month and my insurance isn't doing anything?
And it's not like going and seeing a family doctor where the patient kind of knows kind of what happened that day and the course of treatment. Is that the same for insurance companies? Are they not as savvy when it comes to your business?
Oh, they are very savvy.
Too savvy.
They're too savvy. And they make it very hard for everybody. And I think they do that on purpose,
Yeah.
to be honest. Yeah.
Yeah, I think
I
that's
just think
probably
the
true.
misconception is you're told it's covered,
And then it's
but
not.
you don't understand that it's covered maybe 80%,
Yeah.
but
Sure.
you're responsible for the 20%. So like I said, I have the easy job taking care of patients. The front end is
Yeah.
very hard.
You probably get yelled at on the phone.
Oh,
once
all
in
the
a
time.
while.
All the time.
So working with me is easy. So I didn't know what to talk about. So I first asked my husband, and he says, oh, there's a lot out there about ticks. And I'm thinking, ah. And then I asked the team at our huddle, and they said, oh, yeah, they came up spontaneously with ticks. So I thought we'd talk a little bit about
Ticks.
Yeah, is a tick an insect?
It is a. It's a.
True or false?
False.
Correct, yeah. It's a parasitic arachnid. It belongs to the spider family.
Ugh.
And in Michigan, there's 20 different species.
Really?
And everybody knows about Lyme disease. and that's transmitted by the black-legged tick or the deer tick. The technical term is Ixodes scapularis. You can tell it's one of these ticks because it's a little bit black behind the neck. But the most common tick in Michigan is the wood tick, and there's white spots on it.
Okay.
And finally, Jackson County is now in the red zone in Michigan because we have Lyme disease here. Haven't seen a lot of it yet, but we might. Every year they say it's going to be bad, it's going to be bad.
Yeah.
I've been hearing this since I graduated from my training, and who knows, maybe this year.
Because the lack of rain, does that, obviously the mosquitoes we haven't seen too many mosquitoes.
Well, they actually thought because of the wet spring, maybe that's why we're having more ticks.
Yeah.
So the nurses are coming in, their children have ticks on them, and everybody's, a little bit anxious. I hear at some of the golf courses, there's signs posted to watch for it.
Watch for ticks.
So it's the ABCs of ticks. So I want you all to be aware of it and try to avoid the ticks. And that's how you don't get these infectious diseases. So you want to walk in the center, of wooden paths. You don't want to be out in the edges where there's the tall grass. The ticks don't actually fly or jump. You're normally getting it because you're walking along, the grassy areas. B stands for bug spray. So if you're going to be out for a long time, use products typically with DEET on it. With your children, you want to apply it to their skin. You don't want them to be doing it. And if they do get it on their hands, wash. And then C, clothing. So typically you want to, kind of looks a little dorky, but tuck your pants into your socks.
I will not do that.
I know you won't. You might want to wear long sleeves. You can actually get clothes treated with permethrin, and that actually stays on your clothes for a couple washings. And if you wear light pants, you can see them easier because they're teeny tiny. They're the size of a poppy seed. Most people don't know what a poppy seed is, but it's like the period on your computer screen. Very tiny.
Well, anyone that's eaten at McDonald's knows what a poppy seed is.
Okay,
Well, and what's the show? That one show on Netflix? The Poppy?
Oh, the poppy.
Yeah.
Yeah.
What is that? With Jason Bateman?
What's that?
They have the Poppy Farm? What's the name of that show? It's the most popular show on, what is that on
It's the
Netflix?
South where the people go.
Ozark.
Ozark.
And so when you come in, make sure you check. Sorry, a little sidebar there.
Sorry.
Check, certain areas behind your ears, along the belt line, behind your knees. Your pets also, actually we should be checking the dogs before they get to the garage, not in the garage.
That's for you, McKenzie.
Yeah.
Apparently you're
Someone
not
just
checking
lets the
dogs.
dogs in without tick checking.
If you put in, shower, within an hour or two, and if you put your clothes in the dryer for 10-15 minutes on high, it'll kill them.
Will a shower wash them off if they've
Yes.
lodged onto you?
Yes.
Oh.
If you get it soon enough. I think, go on.
Well, it takes like 24 hours for it to
In bed.
Yeah.
in bed, right?
So for it to transmit diseases, it really has to be on there, typically even more than 36 hours.
Oh, wow.
So there's a little change now. I used to get calls all the time, I got bit by a tick, do I do anything? Well, obviously, first of all, you want to be careful that you remove it properly. So you try to get tweezers and pull it straight up. You don't want to use your fingers and squish it because sometimes that causes regurgitation and it can transmit the little
From the
tick
from the
into your
tick or
skin.
from the adult?
From the tick. And then after you wash it and you maybe clean it off with some alcohol. But there is a difference because we're now in an area where we have Lyme's disease. Some individuals may warrant prophylactic antibiotics after a tick bite. So number one, the drug we use is doxycycline, so you have to make sure they're not allergic. They're supposed to get it within 72 hours of getting bit. It has to be a real juicy, chubby, tick.
Good size tick.
And if they get so big, they oftentimes will just fall off. Because then it's been on you for greater than 36 hours.
They fill up and turn like purple, don't they?
Yeah, because they're filled with blood. They feed
they
on
look
your
like
blood.
marbles on the floor.
So if you don't know what type of tick it is, most people don't. Actually, you can even take a picture of it and email it up to the Michigan Department of Health. and they can identify it for you. But a lot of times I don't think they're going to do it. But the difference is now we're in an area where we have known Lyme's disease. The other disease that the nurses said is out there in the media is another disease transmitted by this tick, of which actually there's 5 diseases by this tick, and it's called babesiosis. And again, a lot of people have no symptoms. Some people get non-specific symptoms, flu-like illness. A few people can get problems where it destroys their blood cells and they get anemia. And some people can get very ill and even die from it. So there's lots of different tick-borne diseases. I think there's about 14 altogether. It's an exam question for infectious disease people. But it's here in Michigan, and some individuals may warrant prophylaxis with antibiotics, but you got to be quick, and some of the physicians may not know that yet. So that's all I wanted to say.
Well, thanks for all the tick news, and thanks for coming in today.
Thank you.
Good to see you both.
The office manager at the PIIC Center, McKenzie Trimble, and infectious disease specialist, Dr. Donna O'Neill. More of the morning show, including a big announcement coming up. Stay tuned.